Well, today on our show,
No, we're not talking about shoes, but I didn't want to show you my feet, but we are actually going to be talking about feet. And we're the foot specialist of Mississippi with Dr. Ricky Roach. Dr. Roach, good to
How
see
are
you.
you doing today? Nice meeting you.
Well, nice to meet you. Now, let's talk about feet. I mean, you're a podiatrist.
Yes.
And this is something that you see a lot of, all shapes, sizes, or whatever. And we have so many people in work here along the Gulf Coast that they're on their feet all the time.
All the time.
And you see, and of course, in the older that we get, we have more feet problems. So tell us exactly what about the science of podiatry.
Podiatry has to deal with anything that involves the feet. It can come from conservative treatment dealing with people with diabetic, which have peripheral vascular disease, neuropathy, patients with heel pain, bunion. In the older population, you know, they have fungal nails that's very painful. Pediatrics, it's a variety of different things that we deal with in the ways that we treat them, surgically or non-surgically. Some of the most common things that we see is heel pain. A lot of people are under misconception that when they have heel pain that it's related to a spur, but actually it's a tendonitis of the plantar fascia, therefore the name plantar fascia. Here is kind of a model of the plantar fascia where that you get it inflamed and it causes pain when you first get up in the morning, and then once you start walking it gets better. One of the most common problems that we see, we probably see 4 or 5 patients a day. Also, we deal with bunion problems where that they have a protrusion on the first metatarsal or the fifth metatarsal and hammering of the toes. These are structural deformities that we see a lot of. Another aspect that we do with heel pain is that we specialize in custom-made orthotics to help the mechanics of the foot. Very good for people that's on their feet all day long, especially casino workers, Chevron workers, anybody that's on their feet, because what a custom-made orthotic does is that it corrects the mechanics in which the foot works. And usually when you have a pathology of the foot, it's because you're moving in a position abnormally, and this here helps to correct that.
So a lot of people that they may be flat-footed or you know, don't have much of a arch or high arches, and that really helps them. You know,
metatarsalgia, balls of the feet.
Exactly, it takes some of the pressure off your toes.
Yes,
and everything. Well, you hear a lot of this in sports. Football players, turf toe.
Yes.
What is turf toe?
Turf toe is inflammation or problem with the first metatarsal where that you have capsule deformity around the first MPJ joint. It's a destruction of the ligaments and things around the first MPJ joint. Very much similar to a bunion pain that you have with turf toe.
And I guess with these football players or athletes that are on their feet so much, you know, and really putting a lot of pressure on them, that can be pretty painful.
It could be indeed, just like the bunions and hammer toes and metatarsalgia and things of that nature there as well. Another thing that causes a lot of pain that we deal with is patients with diabetes. They either have peripheral vascular disease, which basically is a lack of circulation, or neuropathy where they have deterioration of the nerves. We have a test here where we do ABIs to assess that circulation. Before we do any work with those patients, we want to assess to make sure that they heal. We also have biopsies that we do to assess it. We have diabetic shoes to help offload the pressure to prevent ulcers. We do a lot with diabetic ulcers here in the clinic, using different skin grafts and things of this nature here.
Now, as far as diabetic shoes, I want to mention that I know you have one style here. That's a lady's shoe. But the great thing about diabetic shoes have come so far forward nowadays that, I mean, remember when they used to be just the old ugly things?
Big
just
boots.
Big boots, or they just ugly black things or whatever. Now they have, I mean, there's just so many different styles.
They have a lot of styles. We have a lot of patients that's not diabetic that purchase the shoes because the style has improved so much that now you can walk around and you can see a person's shoes and you don't really know that they're a diabetic. So it's a very good thing now with the changes in the styles that they have. We have one of the things here that we've been doing here. This here is called a balance brace. One of the things that happens to a lot of senior citizens that they have trouble falling.
Right.
This here balance brace, and most insurances cover this here, is help them to prevent them from falling. We make a cast of their foot, a mold, just like we do with orthotics, and they wear them inside their shoes, and it prevents and decreases the amount of falling that patients encounter tremendously.
Now, I was wondering how that, I mean, if you just wore that, but you actually wear that inside your shoe.
And it locks your ankle, so therefore it prevents them from falling.
And because, you know, as you said, the older that we get, you know, bones start deteriorating, muscles start deteriorating, especially in areas like that We move around a lot.
We do. We put a lot of miles on our feet, and this begins to show us as we get older. That's why we have a lot of senior citizens that have different foot problems. Fungal nails is a big problem here, especially on the coast with the humidity. It's a very good environment for it. It can be not only painful, but also cosmetic, unattractive to a lot of women and females that have fungal nails. And this is probably one of the busiest time that we have in terms of fungals, treating fungus, because the spring is coming and they want to polish their toenails. So we see a lot of people coming here trying to get treatments for it. And of course we have topical treatments, we have oral treatments, different treatments. We try and offer a variety of different treatment formats, from conservative to surgery, surgery being the last option. And of course also we consider what the insurance company covers and don't cover, so we try and give you options to treat.
Do they need to get a referral from their general physician before they can come see you?
For the most part, no. We open to everybody. You just call and schedule an appointment, and we'll get you in as soon as possible. Now with the home health care that we work with SAD. They usually refer us patients, and we do get referrals from some of the other internal medicine family practice doctors, so that way we can get them in.
And you do have 3 locations here on the coast, so we're going to go ahead and mention that now. Where we are, excuse me, in Ocean Springs in the Heart Center, which is just on the east side, Highway 90 in Ocean Springs, past the bowling alley. You're also at Cedar Lake.
Cedar Lake Medical Plaza, room 100 with ear, nose, I share office there with ear, nose, and throat, Dr. Ray Weiss and Wilson, and also in Orange Grove on Dido Road at Bienville Orthopedics.
I know exactly where it's at. Now you have a couple of other things to show us here. The blue brace.
This here is for a night splint. For a lot of times when you have this plantar fascia tendon that's very tight, one of the things you do to treat it is to stretch it. At night, a lot of times people are relaxed more, so we put them in a night splint. We also address them with custom-made orthotics, as well as injection. So these here are some of the things that we do to treat heel pain, because it is one of the major things that we do. This here are inserts that come with 3 pair of inserts per shoe. And Medicare covers if you meet the criteria and your doctor sign off on it, your family doctor. And basically what it does is that it helps facilitate your gait, distribute pressure, evenly distribute pressure, and prevent ulcerations.
Now, we're about out of time, but we do want to mention that, of course, if you have any problems with your feet, circulation, maybe you've got a sore spot, as you said.
Yes,
it may not be a bone spur, something that just won't go away. Best thing to do to check it out is, because you get on down the line, it could just get worse and worse and really cause you some serious problems as time goes along. So, Dr. Roach, we want to thank you so much for your time.
Thank you.
Don't forget, he's in 3 locations: Ocean Springs, Biloxi, and Gulfport. If you have any kind of foot problems or anything that you're trying to deal with, or maybe, like you said, a little pain in the arch or whatever, or your toes that won't go away, best thing to do is call the number on your screen, get an appointment. You might need one of these things here to kind of ease that pain for you, and talk to him here at the Foot Specialists of Mississippi.